Our organization is committed to improve the disclosure of harm by their healthcare professionals because it is an extension of patient care.
It's the hope of our team that people will be able to access these videos to have a quick look and a quick reminder of what the components of a disclosure conversation are. Disclosure doesn't have to be a complicated process. It doesn't have to be a frightening process. And it's something that all of our healthcare providers can do. Alberta Health Services policy requires that any time a patient suffers any harm, there is the potential for future harm, or there will be a change in care or monitoring because of something that has happened in our delivery of healthcare. We must have a conversation with the patient. We call that conversation disclosure. In the conversation, we always offer an apology, the best explanation we can as to what has happened. We explain future implications and how we as an organization will respond to what has happened.
When you're sick and you're in the hospital, you feel vulnerable, you're sometimes scared, you're not at your best, and you're dependent. So when something happens that's unexpected and maybe not the way we all wanted things to move forward or work out, an apology is absolutely critical. It's powerful.
When I was told we should never apologize, we should never admit that we made a mistake. We were told that for fear of ending up in court. We know a lot more now than we did then, and we know that that advice was wrong. When something has gone wrong, we want to apologize, and our patients expect us to apologize, and it's okay to apologize. There's different ways to say I'm sorry. We can say we're sorry for the circumstances that the patient finds them in. We're sorry that this has happened to them. If we're not sure that we contributed, then that's the type of apology we should use. If we do know, though, that what happened was because of something that we did to the patient, we should apologize and accept accountability for that. Often, in the early stages, we don't yet know the details of what has happened. If we do recognize, though, that a patient has had an unfortunate outcome, and we feel it might be related to the care that we provided or something we have done, they deserve a conversation. In this conversation, they need an apology, and they need an acknowledgement that we're aware. It's best not to speculate, though. If we're not certain, if we ask them for their patience so that we can investigate and then provide them with the best explanation that we can after the investigation is complete, they will usually be okay with that.
It's okay to say we don't know how this happened, but we're going to find out.
If patients approach us before we approach them for disclosure, we know that actually this has a tremendous impact in terms of the credibility of our staff or people in our organization.
I think a disclosure conversation can either rebuild trust or maintain it. We already had a trusting relationship with that team, and I think if they'd not been upfront, that would have really impacted the last part of her treatment and how we felt about them.
The first type of harm is the unfortunate event that occurred. But the second harm is how we responded to the first harm. We know that patients understand it was never our intent to hurt them in the first place and are very willing to forgive that. What patients are never willing to forgive is how we respond after the harm has occurred. If we're defensive, elusive, making excuses, not providing the support that they need, and not helping them to recover. If we're not disclosing and trying to resolve this, they will never forgive us for that.
A lot of emphasis has been on the disclosure when there is a big adverse event, but a lot of what we do on a daily basis does involve smaller errors where the care plan changes or the patient has to be monitored in a way that we weren't anticipating. Families and patients pick up on that. Most of the time families appreciate that, they recognize you're human and they knew something was up. So for you to acknowledge that helps keep those lines of communication open and helps to keep that trusting relationship strong.
When we do disclosure, we don't look at an event from our own perspective in terms of being serious or not serious. We look at it from the perspective of the patient. And a small event, which to our eyes could be simple or not necessarily serious, may be very serious in the patient and the family's eyes.
If something had happened and if the patient is traumatized, their brain is not hearing it. So you might have to have that conversation numerous times to get your message through and to not be afraid of that. It's not as if we talked about that once, well, tomorrow the patient might want to talk about that again, and let the patient decide when they finish talking about it. I think disclosure to me is a process. I guess I'd like to encourage healthcare professionals to kind of work through the fear. Obviously, you're going to be afraid of a disclosure conversation, but to trust that in the end it will be better. And I think that there's a healing aspect for them as well.
Engaging in disclosure with a heartfelt apology and an explanation, that also provides and leads to the wellness and the well-being of the staff member moving forward. Lend yourself also some kindness. Obviously, you're going to extend kindness and empathy to the patient and their family, but you also need to extend that to yourself and your team members. Together, we learn and we improve.
The final message I would have with disclosure is just do the right thing. It's pretty simple. If you were the patient or their family member, you would want to know.
A final reflection that I would have for our staff and our physicians would be that don't be afraid to disclose. We are there to support you through the process.
It's not the medical piece that impacts your experience, it's that person-to-person human connection, and it's that being authentic and showing up even though you are a doctor or a position in power, and it's that human connection. So again, that's being honest and authentic.
Patients tell us that long after their encounters with us, they will not remember what we said, but they will remember how we made them feel.